Hi all, this is Dr. Jeyalakshmi, Senior Consultant, Obstetrician and Gynecologist, Bilroth Hospital, Shananagar. The topic for today I'm going to talk is about breastfeeding. We celebrate breastfeeding every year in the first week of August. This celebration of breastfeeding is to emphasize the importance of breastfeeding, and the theme for breastfeeding this year is to prioritize breastfeeding, create a sustainable support system. So getting into the topic is what are the benefits of breastfeeding for the mother as well as for the baby. So let's see one by one. The benefits of breastfeeding for the baby is it boosts the immune system of the baby, and thus it prevents in acquiring so many diseases like respiratory diseases and certain cancers and certain leukemias, and it also helps to lower the risk of chronic diseases, and it also prevents type 1 diabetes in the baby, obesity and childhood cancers as explained before. And then the benefits of the mother is it reduces breast and ovarian cancers, it creates an emotional bonding between the mother and the baby, and then it also helps in weight reduction for the mother. Good breastfeeding, like when you feed properly, it also helps to reduce weight. And then the position of breastfeeding is also very important. So the position we emphasize are the cross cradle hold position, then cradle position and sideways lying position when the patient is feeding in the nights. And then let's see some of the myths of breastfeeding. So the first myth is when you breastfeed the baby, they say you don't conceive. That is a very wrong idea. So you also get pregnant even if you're breastfeeding the baby. So importance of contraception also comes into play. So as soon as you start breastfeeding, consult your doctor and get a best contraception for yourself. And then the next myth is you cannot take certain diet. Foods to be avoided during breastfeeding is nothing but the foods which are very comfortable for the mother and the foods which they don't actually generally take or they don't prefer. Nothing specifically we say. You can actually consume all the foods like non-vegetarian, seafoods or whichever is suitable for the mother. Next myth is you should not take any antibiotics during breastfeeding, which is also a wrong conception. Antibiotics which are safe during breastfeeding. The important factor which we have to take into note is about postpartum depression, which the mother cannot express and which we have to identify and treat the mothers. So this is very important so that they lack interest in daily activities, they don't take proper food, and this has to be taken into consideration, and while treated properly we can get over this postpartum blues and the mother and the baby will have a good postpartum period. Thank you.